So we now move on to motion 69 to be proposed by Dr. Peter Holden from the Conference of LMCs on behalf of East Midlands Regional Council.
Thank you, Chairman. RB, you think there's a crisis in general practice. The oldest GP provider in Derbyshire, you're looking at him, he's 60. That's how many have gone. No, that's how many have gone. Chairman, we don't formally measure things in general practice. This is our Achilles heel. A classification system which measures workload and patient demand against available workforce and resource is an accepted means of good business continuity management. It allows for an ordered prioritisation of work, allowing us to do the most for the most at times of overload. It's about a good, safe system of care for patients, a GMC requirement. It is not about GPs closing their surgery doors and diverting everything to the local emergency department. It is, and I repeat, about good, safe systems of patient care. It's about the fact that in GP land, nobody else takes any notice of the frequently quite impossible workloads, with everyone presuming that GPs will simply cope. When it all goes wrong, the impact in a hospital is dissipated amongst the organisation, but in general practice it's very personal, impacts upon the GP principal wholly and solely. It's well established after the 17th consultation in general practice, standards fall because of attention and concentration fatigue. In Europe, most and decision-making fatigue. In Europe, most GPs think 25 patient contacts a day is the safe norm and 40 per day is overload. For UK GPs, 40 consults a day is the starting point before the 35% administrative tail dealing with prescriptions, visits, letters, lab reports, let alone the consumer complaints and managerial demands. In the average 7,200 patient practice with average demand, simply to accommodate doctor holidays for 17% of the year, individual GPs are working at 1/3 above safe levels simply to cover the holidays. Locums frequently cannot be found even if they can be afforded, despite adequate forward planning. Mix in sudden sickness and one of the three remaining doctors and personal workloads double. The risks of a mistake under such circumstances are magnified hugely, and therefore it's imperative that we develop something such as a green, amber, red, black alerting system, and vital in order that GPs can stratify their capacity and stratify their response to maintain safe systems of care. This would then give GPs a defence at the GMC, as so often complaints about a GP are not the result of personal professional deficiency, but system failings outside their control. I suspect we're going to have to do this as an association, as the chance of government introducing any measurement which could highlight their chronic under-resourcing of the service is remote. Be that as it may, we owe it to ourselves and particularly to those colleagues who've ended up with GMC investigations against them purely because of mistakes which are fundamentally based in gross work overload. Chairman, I look forward for unanimous support.
Thank you, Peter. Can I call